Today's topic is something a lot of men feel but few understand. We are talking about low testosterone. It doesn't just affect your gym gains, it can impact your mood, your drive, even your sense of identity. So let's break it all down. No hype, just facts and solutions. Now, here is something you should understand. Testosterone isn't just the male hormone. It's a co-regulator of everything from muscle growth to mental clarity. It fuels your energy, your confidence, and yes, your sex drive. But when your testosterone drops, everything starts feeling off. Is low testosterone a young man's problem too? Let's tackle this head on. Isn't low testosterone only an aging problem? Not quite. Low testosterone in young males is now being reported more than ever before. Stress, processed food, lack of sleep, and endless screen time all play a role. A peer reviewed study in the Journal of Sexual Medicine found that testosterone levels have been declining across age groups, not just in men over 40. So, how do you know if your testosterone is running low? Here are the top low testosterone symptoms in men. You feel tired even after a full night's sleep. Your sex drive has vanished or seriously dipped. Difficulty getting or keeping an erection, loss of strength or muscle mass despite workouts, brain fog or forgetfulness. You get irritated easily or feel down for no reason. You are gaining belly fat without changing your diet. Beard or body hair seems thinner than usual. You are having trouble sleeping deeply. Fertility concerns or reduced semen volume. If several of these resonate, it's worth looking deeper. For younger men, the signs can be even more frustrating. For example, struggling to build muscles, delayed puberty signs, feeling unmotivated, puffy chest or gynecomastia, low confidence or energy in social settings. Here's the kicker: most young men never consider hormones the culprit. They blame stress, overwork, or diet, but low testosterone levels could be the root. Now, let's shed light on something deeper. Testosterone impacts more than the body. It shapes how you feel about yourself. Men with low testosterone often describe feeling flat, uninspired, or emotionally disconnected. It can even strain relationships. If you are feeling this, you are not alone, and there are answers. Now, let's get to the root of the problem. What's draining your testosterone levels? Here are the usual suspects: natural aging, being overweight, especially around the waist, constant stress and elevated cortisol levels, too little sleep or poor sleep quality, a sedentary lifestyle, medical conditions like diabetes, testicular injury or infection, certain medications like painkillers, antidepressants, and steroids. Also, excessive alcohol or smoking, hormone disruptors in plastic containers or personal care items. Even seemingly small things like skipping breakfast or late night screen time can chip away at your testosterone levels over time. A very common question I get is, how do I know for sure if I have low testosterone? The answer is very simple: a blood test, usually done in the morning. In some cases, you will also need to test free testosterone, luteinizing hormone, follicle stimulating hormone, and prolactin or thyroid levels. Now, let's talk about what to do when your testosterone is genuinely low. There are two main paths. The first one is natural lifestyle change. For example, you need to lift weights 3 to 4 times a week. Sleep like it's your job. Eat for your hormones, not your cravings. Reduce stress. Cut the junk food, alcohol, and nicotine. Sometimes these are all you need to restore balance, especially if your testosterone is borderline. The second method is testosterone replacement therapy. If your testosterone is significantly low and symptoms are severe, then testosterone replacement therapy might be an option. It comes as injections, gels, patches, implants, and nasal delivery. But remember that testosterone replacement therapy isn't for everyone. It can reduce sperm count and has many risks. That's why it should always be doctor supervised. Now, a question arises: are you a good candidate for testosterone replacement therapy? Let's make it simple. You have been diagnosed with low testosterone. You have clear symptoms, natural methods haven't worked, and you are aware of the risks. Then, and only then, consider testosterone replacement therapy. Let's talk about the natural way to reboot your testosterone. Your diet can either destroy your testosterone or build it up. Add the following foods to improve your testosterone power, like eggs, don't skip the yolks, wild salmon, and sardines, which contains vitamin D. Also, pumpkin seeds and cashews, which are loaded with zinc. Spinach and lentils, which are packed with magnesium. Olive oil and avocados, because they contain healthy fats and healthy hormones. Brazil nuts, which are the selenium powerhouse. Stay away from excessive sugar, processed food, and seed oils. Trust me, your hormones will thank you. Next up, you also need to do exercise. Heavy resistance training, think squats, rows, and deadlifts. Short, intense cardio like sprint intervals. Avoid overtraining because too much cardio can lower testosterone. Consistency is the key. You don't need fancy equipment, just commitment. Now, let's talk about daily habits, the hidden gold mine. Sleep. Aim for 7 to 9 hours, ideally before midnight. Sunlight. Just 15 minutes of sun can boost vitamin D. Stress management. Meditation, deep breathing, prayer, walking all reduce cortisol levels. Cut plastics because BPA and phthalates are testosterone's silent enemies. Finally, let's touch on natural supplements that support testosterone. If you are deficient, then add vitamin D, zinc, magnesium, ashwagandha, and fenugreek seeds because they may improve libido and muscle recovery. So, here is the takeaway. Low testosterone is more common than you think, but it's manageable. With the right actions, you can restore your energy, focus, strength, and confidence. You owe it to yourself to feel like you again. If you found this video helpful, hit like, subscribe, and share it with friends and family. And don't forget, your health is your power.